AI is quietly changing, well, pretty much everything, right? And that definitely includes how we get our health information. Today, we're going to dive into something really cool, how these specialized chatbots are becoming this powerful new tool in public health. Oh, come on, you've totally been there. You have one simple health question, you type it into a search engine, and bam. 2 hours later, you're deep down this rabbit hole of conflicting articles, super confusing medical jargon, and let's be honest, a whole lot of unnecessary anxiety. It is so overwhelming.
But what if there was a better way? A tool that's actually designed to cut through all of that noise, one that gives you clear, simple, and reliable answers. Well, that's exactly where these specialized health chatbots are starting to come in.
Okay, so let's back up a second. What even is a chatbot? At its core, it's pretty simple. It's a computer program you can have a conversation with. It's designed to understand your questions and give you specific info or help you with a task, all through a simple chat, just like texting a friend. All right, so how do these things actually get made? Let's pull back the curtain and take a quick peek at what's going on behind the code. It really comes down to a four-step cycle. First, you have the design phase, where developers map out the chatbot's purpose and how conversations will flow. Then, they build that basic structure. The third step, and this is the really critical one, is training the AI. And finally, it's deployed for people like us to use. And that training phase, that is everything. It's what separates a generic chatbot from a truly specialized health tool. Think about this quote. It's like teaching a student. The AI is fed huge amounts of vetted, expert health data. We're talking research papers, medical guidelines, the whole 9 yards. It keeps learning until it can recognize patterns and provide really intelligent, relevant answers. And here's the thing, developers aren't usually starting completely from scratch. They often use these powerful platforms, like Google's Dialogflow or IBM's Watson Assistant, to build these tools. These platforms basically provide the foundational AI that can then be customized and trained for all kinds of specific public health needs. Okay, so we know what they are and a bit about how they're built, but where are they actually making a difference out in the real world? Let's get into the use cases. First step, emergency response. During a public health crisis, think a pandemic or a natural disaster, these chatbots are invaluable. They can instantly get accurate safety information, guidelines, and updates out to millions of people all at once. It's a massive tool for fighting misinformation in real time. Then there's symptom checking. A chatbot can act as a kind of first line of support. It'll guide you through a series of questions to help you understand your symptoms and suggest what to do next, whether that's just taking care of yourself at home or if you should actually see a doctor. They're also fantastic educational tools. They can provide information on anything from vaccination schedules to healthy eating habits. It's a great way to support public health campaigns and encourage positive changes in a way that feels really accessible and conversational. And for people managing long-term conditions like diabetes or hypertension, this is a game changer. A chatbot can be like a daily assistant right in your pocket. It can send you medication reminders, help you track your symptoms, and even provide some motivational support. It helps empower patients to be more proactive about their care. But let's be real, this technology is not a silver bullet. It comes with some really significant challenges and some serious ethical questions that we absolutely have to navigate carefully. Two of the biggest concerns right out of the gate are accuracy and bias. Can we absolutely trust the information the AI is giving us? That's non-negotiable. And just as important, was the AI trained on data that represents everyone, ensuring that it gives fair and unbiased advice to all users, no matter their background? And beyond that, you've got data privacy. We're talking about incredibly sensitive health information here. Plus, we need to clearly define the responsible way to use these tools. They are a support system, remember, not a replacement for a doctor. This leads us to a central dilemma, maybe the biggest one of all. If a chatbot gives someone harmful advice, who's accountable? Is it the developer, the health organization using it, the platform it was built on? This is one of the most pressing legal and ethical questions in the field today. Now, despite those challenges, the potential here is just enormous. So let's shift our focus and look ahead at where this conversational technology is going. We're looking at three major trends on the horizon. First, deeper integration with our actual health systems. Think chatbots that can schedule appointments for you. Second, incredible scalability, reaching entire populations. And third, the emergence of completely new capabilities as the AI just gets smarter and smarter. And to be clear, the level of integration and the impact we're seeing today is just the beginning. The potential for these tools to become a core part of our public health infrastructure is absolutely massive. And that really brings us to the key takeaway here. It is so crucial to remember that this isn't about replacing human healthcare professionals. It's about augmenting them. It's about empowering all of us with information and supporting public health systems on a scale that we've just never been able to achieve before.
It's a powerful vision, isn't it? One where everyone could have instant access to reliable health guidance. And it leaves us with a final, really important question to think about. As this technology evolves, how is it going to truly redefine our relationship with our own health?